I am Dr. Tamilarasi, nephrologist, right now professor and HOD, nephrology department, Christian Medical College. I started my career in nephrology field 1979. Then I took interest, joined in DM nephrology. From as a nephrologist, I am in this field from 1989 onwards. Nowadays, people are very much interested to know about renal disease, especially kidney failure, because it is very much prevalent. If you take, first of all, you must know about the kidney. There are two or kidneys in our body, which is situated just behind. Then it is like bean shaped. This chronic kidney disease, this renal failure, if you take, it is acute renal failure or chronic renal failure. Acute renal failure, that is a sudden onset of a renal failure previously whose kidney was functioning very well. Then it recovered soon, usually following dehydration because of a loss of fluid, blood or plasma. Because of dehydration, they will go for acute kidney injury. They will recover fast, a matter of within 3 months they will recover, replacing fluid. Especially in children following diarrhea, they developed acute renal failure. But in case of chronic renal failure, if you take, it means that it is a chronic disease. It won't recover within 3 months, but it takes a longer time. If the renal failure occurs, persists more than 3 months, we will call it as chronic renal failure. Nowadays, we will call it as chronic kidney disease. It is due to, it may be structural or functional abnormality with reduction in GFR, that filtration is reduced. It is diagnosed by pathologically or documented by urinary abnormality, blood abnormality or imaging abnormality when the GFR is less than 60 ml per square meter body surface. Without GFR, reduction in GFR. What are the causes of this chronic renal failure? If you take a whole world, diabetic is the commonest cause of chronic renal failure, chronic kidney disease. India is the capital of diabetic. So, the commonest cause of chronic renal disease is the diabetic. Next come hypertension. Following that, you will have other disease, glomerular disease. Glomerular disease may be so many pathology, this nephrons will be affected, causing this mesangial proliferative disease, membranoproliferative, rapidly grow. Like that, many causes causing glomerular disease. In females, systemic lupus erythematosus. Other causes causing chronic renal failure, obstructive uropathy. The obstruction may be anywhere in the urinary tract, will be there. If you take in children, the commonest cause of obstructive uropathy is posterior urethral valve. Then reflex nephropathy will be there, neurogenic bladder. Like that, it will be when there is obstruction. Or congenital anomalies, that is in children, polycystic kidney, autosomal recessive polycystic kidney. In adult, it will be autosomal recessive polycystic, multicystic kidney disease. It will be. Then following that, this sometimes we don't know what is the cause of renal failure, because why we are not able to find out the cause, because they will come very late stage. We are not able to know the cause of renal failure. There are various stages, nearly 5 stages, starting from 1, 2, 3, 4, 5 stages according to GFR. when the GFR is more than 90 ml square meter body size, that is stage 1. Then stage 2, that is 60. Stage 3 is more than 30. The fourth is more than 15 to 29 ml per square meter body size. Less than 15 ml, that means there is end stage renal failure. Actually, stage 1 and 2, we can go for conservative management, that I'll tell you later. But in case of stage 4, you must prepare the patient for dialysis. Stage 5, they come, that means that is the end stage. Best treatment modality is transplant. How to identify this chronic renal failure? Is it just all cases will be stereotype the way of symptoms, signs? It is not so. Actually, many people come with the end stage renal failure. When they go to the doctor, just for some other purpose, just abdominal pain, they'll go there, they'll do this creatinine, and they found out that is the end stage renal failure. So it is a silent. So because a silent, there is a renal failure. But most of the time they'll have some symptomatology like loss of weight, and anorexia, not taking food properly, vomiting or vomiting sensation, losing weight, the body pain, bone pain, or a difficulty in breathing. Or sometimes they'll have without this just no appetite at all, not taking food, losing weight. Then the creatinine, they do it, want to be, that is a chronic renal failure. Then they'll have a recurrent episode of diarrhea and constipation, they'll have it. The most common symptomatology we'll see in kidney disease, just puffiness of the face, swelling of the face, lower limb swelling, they'll have it. Especially this just below the eyes, there will be a swelling, they'll have it. Or a change in color, they'll have. Then the quantity of the urine, less amount of urine, they'll pass it. There is painful micturition or burning micturition, or sometimes they'll pass a lot of urine, or they pass frequently they pass a small quantity of urine, they'll pass urine like that. Sometimes the color of the urine itself is quite different. They'll have reddish urine. When they have passing blood in the urine, they'll have red color urine. Or sometimes they'll pass a stone or muddy. When they have renal calculi disease, they'll have it. They'll pass small stones or sandy material, they'll pass it. Like that, they'll have this symptomatology is very much variable. It is not the same thing as kidney disease, means they'll have these symptoms like that. If you take jaundice, this yellow color, they'll have it. But in case of renal failure, it is very difficult. Sometimes they'll have external manifestation of this renal disease. We can able to, this color of the skin will be going on increasing, and darkening of the skin, they'll have it. Or if you take eye changes, they'll have a reddish eye. They'll think that it is a conjunctivitis. By mistake, they'll treat for conjunctivitis. It is not, because of calcium is very high, hypercalcemia. They'll have a deposition of the calcium in the eye. They'll have a reddish eye, that is called red eye syndrome. Then have a severe pain in the leg, especially the night. They'll have severe pain, that is, we'll call it as restless leg syndrome. Like that, the symptoms will be very much variable, they'll have it. Then what shall we do it? How can you diagnose? When you think of some renal problem, when we suspect renal disease, some of the basic investigations start with the urine analysis, whether there is passing and this protein is proteinuria, that is called, or they are having hematuria, or they are passing a stone. we must, or this urine analysis, this cysts are there, we must find out the RBC cost, WBC cost, it is there, we must find out so that we can diagnose the disease. Blood test, we must do it. By basic available wherever, even a small place we can do it is urea creatinine. But creatinine is very important compared to urea, because even when there is a dehydration, normal function kidney, the urea will be increased. But when there is a renal failure, even a 0.1 milligram raise in creatinine, that is some renal damage. Then we must do nowadays everywhere you can have the facility of ultrasonogram. By doing this ultrasonogram, what happen, size of the kidney will be reduced according to the age. It will be the size of the kidney less than for that age group. Then there is the texture will be increased echogenicity, we will say increased echogenicity will be there. Like that we can able to identify, yes, the kidney is shrunken kidney, both kidneys are shrunken for that age. We will tell them that they are suffering from chronic kidney disease, end stage renal failure, or multiple cyst, that is ADPKD, autosomal dominant type of polycystic kidney disease. Then we know, though it is a congenital since birth it is, but the renal failure manifests after the third decade only in case of autosomal ADPKD. Then it is very much variable from age to age. In children, this is the commonest cause of chronic kidney disease is congenital anomalies. Next only you will have it glomerular disease. Then hypertension will come. Vice versa in case of adult, if you take diabetic hypertension, glomerular disease, obstructive uropathy will come. Then after doing, once we diagnose this thing, chronic kidney disease, what shall we do it? Of course, there is 3 modalities of treatment. That is conservative management, dialysis. Conservative management, we have to control the disease. According to the disease, diabetic hypertension, glomerular disease, according to that we have to, this if you take, then we know, though it is a congenital since birth it is, but the renal failure manifests after the third decade only in case of autosomal ADPKD. Then it is very much variable from age to age. In children, this is the commonest cause of chronic kidney disease is congenital anomalies. Next only you will have it glomerular disease. Then hypertension will come. Vice versa in case of adult, if you take diabetic hypertension, glomerular disease, obstructive uropathy will come. Then after doing, once we diagnose this thing, chronic kidney disease, what shall we do it? Of course, there is 3 modalities of treatment. That is conservative management, dialysis. Conservative management, we have to control the disease. According to the disease, diabetic hypertension, glomerular disease, according to that we have to, basic investigation we must do it. This is a urine analysis. Kidney problem means first start with the urine analysis, then blood test, and then X-ray chest, abdomen, ultrasonogram. Then other investigations, nuclear, this DTP, DMSA scan. By doing this urine analysis itself, we can be able to diagnose some of the disease. For example, when seeing this deposit, various cost, we are able to, whether we are dealing with the pyelonephritis or we are dealing with any glomerular disease or hematuria, whether the hematuria is glomerular hematuria or non-glomerular hematuria, or in case of systemic lupus, we can be able to see all this cost, we can be able to RBC cost, WBC cost, hyaline cost, waxy cost, all cost. So start with the simple test. Then other blood investigation, urea creatinine. Urea sometimes what happen, raised urea doesn't mean that kidney is fail. There is a failure in kidney, because when there is a dehydration there will be rise in urea. So the creatinine will be very important. Even 0.1 milligram rise in creatinine should be think there is something wrong with the kidney. Then we must proceed with the other investigations. We must do it, because this risk factors for this chronic kidney disease, like smoking, alcoholism, fat, increase of fat, that is dyslipidemia, high cholesterol. There are adding factors for this chronic renal disease. So we must do this cholesterol level, serum total protein, albumin, 24 hours this calcium phosphorus, electrolyte, 24 hours protein, we must do it. Then other virology test, because this hepatitis B, hepatitis C, all these things cause renal damage. Then complement, when there is a sophisticated places, we will have the C3, C4, ANA, C-reactive protein, double standard DNA, we will do it. Of course, many institutions will have right now DMSS scan, DTP scan, MRI, so that we know the size of the kidney, function of the kidney, what percentage it is functioning, we can find out after knowing. What's the patient is end stage renal failure, stage 5. 4 means we can go for dialysis. Dialysis, you must know that there are 2 types of dialysis, peritoneal dialysis and hemodialysis. Peritoneal dialysis, that is called home dialysis. They need not go to hospital. Once they learn, they themselves can do it, or the attendants can help the patient to do it. Continuous dialysis will be going on. That is, they put the fluid into the peritoneal cavity. What happened? There is a dialysis going on throughout day and night. Nowadays APD, only in the night they will have the dialysis, or they will have this daytime alone, they will have this peritoneal dialysis. This peritoneal dialysis manually we can do it, or it will be connected to the machine, so that the machine will do this entire peritoneal, this procedure will be going on. Night they will connect to the machine. The patient will go to sleep. Morning they will get up, go around, they can do their regular work. So that they need not go to hospital. If they have to get any advice, then can go there. Or nowadays staffs are they'll go and see the patient and help them. The other dialysis is hemodialysis. Hemodialysis, we take out the blood from the patient. After purification, it will enter into the body. So that we must have a dialysis, that is hemodialysis machine will be there. There is for that we need access, that is femoral vein or jugular vein or fistula. This permanent thing will be better immediately when you want to start hemodialysis, femoral vein. We can plan, then we can go for this AV fistula, we can plan it. After maturation, we can start hemodialysis. This access is very important for hemodialysis, but not in case of peritoneal dialysis. One thing in the children, we find this vascular access is a problem. Older children, more than 10 years, it will be easy to have this vascular access. Once we start a dialysis, they will have this diet. They need not, they will be little bit free. Otherwise, previously, when they are a renal failure, they have to restrict so many things. They have to restrict the protein. Just 0.6 gram per kg only they can able to take. Protein diet, people, especially non-vegetarian, they love to take protein. We'll ask them not to take protein. They have to restrict protein. So this fruits also, limited fruits only they can able to take. these diabetic patients or renal failure patients, they have to restrict fruit, this apple, guava, pineapple, papaya, then pears, they can take. If they take this non-vegetarian, they can take only this chicken, fish, they can take. Better avoid meat because more of a cholesterol, because once there is a renal failure, what happens, it affects heart also. That is called cardiorenal syndrome. Like, this increased cholesterol will cause atherosclerosis, then cardiac problem. So diet is also very important. Then what happened is the proton dialysis will continue, but hemodialysis, the patient must go to hospital. This at least twice a week they must have a dialysis. Then they must have one session for 4 hours. That is very important. Then only they can able to maintain their life. Then during because they will be losing this, they become most of our patients we see they will be anemic. So we have to replace erythropoietin. Important function of the kidney, we think only this elimination of this urine formation. It is not like that. It has to maintain this electrolyte, calcium phosphorus metabolism. Then manufacturing RBCs, erythropoietin. So when the kidney is failing, definitely they will go for anemia. So we have to replace this erythropoietin by giving erythropoietin injection after dialysis. But once we start dialysis, the patient will be need not very strict on their diet. They can take more protein, either this proton dialysis or hemodialysis, 1.2 gram per kg per day protein they can take. Then potassium, this potassium, increased potassium will affect the heart. So they have to least potassium when they are not in dialysis. But when they come to dialysis, the potassium, everything will be removed. So the food will be very much liberalized. In proton dialysis, they will be losing lot of protein. So more than normal protein they must take. Otherwise, what happen? They will become undernourished. They will become so weak. They themselves will say, because they'll either proton dialysis, hemodialysis, they will remove fluid also. So we should be very careful about fluid. During hemodialysis, they should not liberalize fluid intake in between dialysis. What happen? They think that during hemodialysis they remove fluid. Whatever fluid they want to take, they take and become lot of fluid will be in the lungs. Suddenly they will go for emergency. Immediately they will go to hospital to have dialysis. So increase of weight should not be more than 1 kg in between 2 dialysis. So we should be very careful taking a fluid. Protein we can be liberalized. Then potassium we have to least vegetables and take. Fruits, just limited fruits, they must take it. Just need not take all the fruits in one day. Just every day one fruit we can take. I am Dr. Tamilarasi, nephrologist. Right now I am Professor HOD, Nephrology Department at Christian Medical College. I started my career in nephrology field 1979 in Madras Medical College. I did my DM nephrology in Madras Medical College 88. Since then I am working as a nephrologist. Today I am going to talk about the important topic of chronic kidney disease. If you take this kidney disease, important kidney disease, very much firing problem is chronic renal failure. you take renal failure, it is acute renal failure, chronic renal failure. Acute renal failure is just a short period, a matter of 3 months they will recover. Common causes, if you take dehydration following diarrhea, vomiting, loss of blood, or following some drugs they develop, or a snake bite, or in case of pregnancy, acute renal failure. Within 3 months they recover. But chronic renal failure, now we call it as chronic kidney disease. They will recover after, it will take long time, more than 3 months. Why it is, what is the cause of chronic renal failure? What happened? There is a damage either to structure or functional damage. So it is not functioning properly. It is documented by doing this blood or urine analysis, or doing this imaging. So the GFR will be less than 60 ml per square meter body surface per hour. What happened? The GFR is going on and decreasing. Then the stage of renal failure is also increasing. Starting from stage 1, it will go to 5. Stage 1, the GFR will be more than 90 ml square meter body surface. As the stage goes, in case of 5th stage, it will be less than 15 ml per square meter body surface. In stage 4 itself, we must prepare the patient for dialysis. Stage 5 is definitely they must go for transplant. And what are the causes of chronic renal failure? If you take the world, globally diabetic, it is the commonest cause of chronic renal failure. India is the capital of diabetic. So, cause of chronic renal disease, diabetic, hypertension, glomerular disease, obstructive uropathy, some obstruction in the urinary tract. Then congenital anomalies, cystic disease, renal stone disease. But this is in case of adult. In case of children, commonest cause of chronic kidney disease is congenital anomaly, obstruction. Congenital anomaly, hyperplastic kidney, dysplastic kidney, or obstruction in the posterior urethral valve. The symptomatology is not stereotype. It is very much variable. Some patients will have just a confusion. Some patients have difficulty in breathing, or abdominal problem, diarrhea, vomiting, anorexia, not taking food, so going for loss of weight, or muscle pain, there's a bony pain, night they won't have a sleep, confusion. Then urinary abnormalities, reduction in urine output or increase in urine output, passing urine frequently in the night, or frequently passing small quantity of urine, change in color of the urine, reddish urine, that is called hematuria. Sometimes they'll pass frothy urine. When they pass a lot of protein, they'll have frothy urine. Or sometimes they'll pass stony material or muddy material. In case of a renal stone disease, they'll pass a stone. This is a urinary of frequent or painful micturition, or stranguria, burning micturition, they'll have it. Or intermittently they'll pass, or dribbling of urine, or straining micturition, they'll have it. Usually many patients will come with a history of puffiness of the face, especially around the eyeballs, just below the eyelids. That is the commonest symptom they will come across. So this symptoms, sometimes a patient without any symptoms, they will go to doctor for some other purpose. They will found out this they having renal failure. Doing some basic investigations, urea creatinine. Creatinine will be raised creatinine. That also they will come across. So these basic investigations, if you take this urine analysis, then urea creatinine, hemoglobin, the serum total protein, albumin, globulin, then diabetic for this fasting sugar, postprandial sugar, calcium, phosphorus, electrolyte, then on this 24 hours urine protein, or virology test, this hepatitis B, hepatitis C, all these basic investigations. Of course, taking a X-ray chest, X-ray abdomen, we can able to diagnose stone disease, X-ray abdomen. Or ultrasonogram, size of the kidney will be smaller in size, because it is everywhere it is available. To know the function of the kidney, they will do it DTPS scan, nuclear studies they will do it, or MRI scan they will do it. Sometimes this ultrasonogram, normal size kidney or big kidney, creatinine is so high, patient is not voiding urine, we don't know what to do. Previously normal patient, matter of 6 months all the problems started, then we must go for renal biopsy and do this, so that by histologically we can able to diagnose renal failure. Then especially this ultrasonogram helps the patient, bilateral small kidneys, then we must suspect chronic renal failure. Then looking at the patient, can we diagnose this? They'll have this growth will be reduced. Some patients they'll have the growth, or skeletal anomalies they'll have it, or color of the skin, blackish skin they'll have it, or a reddish eye they'll have it. Like that, by seeing the patient, we can able to diagnose chronic kidney disease. This all the symptomatology, what to do then? Whether medical line of treatment or any other, immediately they must go for surgery. It is not. Early stage, this is stage 1, stage 2, then they can go for conservative management. They have to control hypertension, they have to control the diabetic, they have to control the infection, electrolyte imbalance, they have to correct. Like that, early stage we can do it. When the stage 4 and 5, stage 4, we must prepare the patient for a dialysis. It depends upon the type of dialysis. When there is a facility for hemodialysis, they can go for hemodialysis. There is no facility for hemodialysis, they must go for peritoneal dialysis. This depends upon that. Peritoneal dialysis, throughout the day and night dialysis going on. Hemodialysis, they have to go to hospital and do the dialysis. At least twice a week they must go to hospital, and for 4 hours they will undergo this dialysis. 3 times a week it is good. When there is no facility, they must go for peritoneal dialysis. Peritoneal dialysis also sometimes throughout the day or at night only they can have it. Night when they want to have, they will buy a machine and connect to the machine. Then dialysis going on. Hemodialysis, blood will be taken from the patient, and after purification it will return to the patient. Only advantage in case of peritoneal dialysis, they need not go to hospital, they need not have vascular access. In the house itself they can continue dialysis. In hemodialysis they have to go to hospital, they must have a vascular access, that is different type of access according to the emergency or planned, they will have various types of access, and this femoral or jugular access or arteriovenous fistula, like that they will have it. This advantage of going for peritoneal dialysis, hemodialysis, once they go, they need not restrict food. When they are on conservative management without going for dialysis, then they have to restrict their food intake. They have to restrict protein. They must restrict sodium, because if they are not restricting sodium, what happen? The swelling will be more, the urine out will be less, the problem will be like that. In case of peritoneal dialysis or hemodialysis, fluid will be removed. Then they will be losing protein also in case of peritoneal dialysis, because all the toxins will be removed. So we can liberalize protein intake. They can take more normal diet, more than that protein they can take. Protein means this non-vegetarian diet is more of a protein than a dal protein diet. Cholesterol we have to control. That avoiding this meat must, because meat more of cholesterol, it causes what happen, atherosclerosis, blood vessels will be thickened, then it will it affect the heart. So you must avoid meat. While taking chicken also, while cooking, what we must do it, you must remove the skin and must do it. Avoid adding this oily, fatty food we must restrict, so that this cholesterol will be reduced. Salt intake we must reduce, so that we can control hypertension. By reducing this taking the most of the fruits, it will be potassium content. So taking some of the fruits which are less potassium, no potassium, for example apple, guava, papaya, pears, they will have less potassium, they can take. Not all the fruits, large amount, a small quantity every day they can take. Non-veg also every day they can take, chicken, fish they can take, without adding more of oil or ghee, butter, all these things. They can take daily 100 gram of chicken or fish they can take. See, how long we can go for this dialysis? If a young patient, 25 years, for a long period they cannot go for dialysis, so we must go for transplant. Transplant means what is this? Because both the kidneys are affected, we have to replace we must give one kidney to the patient. This is donors. We cannot take from some other person. Blood related donor is the best. If they get a blood related donor, kidney will be living, kidney will be functioning for a long period. Patient also will be living for the long period. So living related donor is best instead of going for unrelated donor. So who can donate kidney? Related donor, blood related donor, same blood group or O patient, they can give a kidney to the patient. Nowadays it is very difficult. What to do? We cannot able to get a same blood group or O in the same family, even they want to give. So they are going for a swap. Two patients one side, and the other side two patients, patient and donor and recipient, they will swap. It is accepted by the government. This then age also is very important. Some people they want to give 70 years. After 60, the donor cannot donate a kidney. So the age is also very important. They also should be free of some of the disease. Diabetic related parents of they are not able to donate. If there is a hypertensive patient having only one drug, they can donate. Even a renal stone, a small stone, then they can donate. So who can donate? Blood related donor, same blood group or O blood group they can give. Now other transplant is going on, that is a cadaver transplant. This is a cadaver transplant. It is actually in Tamil Nadu we will have a registry. According to the, they have to register according to seniority. Once we can get it from the cadaver, then it will be given to the recipient. The cadaver transplant. It is going on very well in India, especially in Tamil Nadu it is going on. Then after transplant or before dialysis or without dialysis, this food is very, very important. See, when they are not on dialysis, we have to restrict the protein. They have to least the vegetables intake. But once we start the dialysis, either peritoneal dialysis or hemodialysis, we have to, they can liberalize protein intake, 1.2 gram per kg. They can take more. Instead of this non-veg, they can take more. Especially they have to take more protein. Otherwise, they will become very weak because they are losing protein, especially in peritoneal dialysis. Then this patient, in case of hemodialysis, blood is taken off. After purification, it will be returned. For so many times we have to take the blood for investigations because they are chronic renal failure. Erythropoietin synthesis is very, very much less. So we have to give, become anemic. We have to replace this. We cannot replace blood because of this infection. Sometimes they will develop giving blood immediately. They will develop a fever or malaria, some other problem they developed. So avoiding, we are giving erythropoietin. After each dialysis, they will give erythropoietin. They will give this dormopoietin. This will give once in 2 weeks. We will give dormopoietin. Like that, replacement is also essential. This B complex we have to replace it. These are the things. This is basic things I have told regarding chronic renal failure, that is CKD. What are causes when we must do dialysis and transplant.